Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
So just a chronic, I'm sure I heard it playing
Tennis
pickleball.
elbow?
Yeah, that's what, about 3 years actually I've been suffering with it.
Tennis elbow,
Yes.
3 years. And so you injured while you playing sports, and for the last 3 years, what kind of treatment did you have there?
Nothing. Sometimes I would ice it. Sometimes I did buy one of those bands that has the little bladder.
Elbow bands, yep.
Yeah, just to stop the movement, but a lot of stress and pain. And actually, when I got a massage, the masseuse said that I carry a lot of stress and strain in my forearms, and so I'm wondering if that's all connected.
A lot of scar tissue.
Yeah.
Yeah, I can feel it here. So the last 3 years you had kind of massage, and how much pain you feel there from 0 to 10? 10 is emergency room.
Right now, like if I move it, it's like a 3. But if I'm playing, it can be 6, 7.
So 3. Let's do the motion that actually aggravated. Do the motion that.
So
aggravated.
this actually, I guess it's my backhand.
Okay.
That
How much pain when you do
forehand. Yeah, I mean it's
that?
the longer. Yeah, this is better. The
Okay.
longer I do it. Oh yeah, this.
0 to 10.
Yeah, it's probably about a 6.
About a 6. This
Yeah.
is a new sport with ASTR, by the way.
Training.
Yeah, just don't hit someone's head with this, okay? So 6 when you did this.
Yeah.
So okay, we're gonna use that motion to reevaluate the response to the treatment. So what's going on here? There's a scarring here.
This is a burn from cooking at the church.
Okay, that's good. Too high up here. All right.
It was a double. It slipped and then it slipped again.
Yeah. So you feel that scar tissue?
Yes.
So I definitely can feel that. So what I'm gonna do now, I actually gonna work on the proliferation stage, which actually working on the scar tissue, the fascial restrictions, the muscle spasm, and trigger point that she has here in the tennis elbow. And I'm not gonna do anything for the inflammation, just to rule out if your problem is purely proliferation stage, which is like a scarring and tightness internally, or you have some inflammation that your body going back and forth between inflammation and proliferation. You feel that's a very big knot
It's
here, and I can
huge.
feel it. And sorry.
No, it's
Relax your shoulders.
It is true.
Relax.
It's
So I put my finger here, and you can see my hand is just rolling over the knot.
You mean that's not my muscle?
Yeah, your muscle should be a little bit softer. Like you have a knot here, but should be soft like that. Yeah, but that's a very hard scarring. And that's very common with tennis elbow. You have this muscle scarring here because your muscle attached here all the way to your fingers. And when that happens in a state, because our muscle should act like a rubber band, we contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, will not stretch much. That's why when you try to do the motion that require more muscle contraction, more stretching, it's that knot is prevented from full stretching. And it's very common too, actually, with the tennis elbow, that patient have scar tissue in the biceps muscle. Your biceps attach here to your elbow, and that's a common location for scarring. And you can feel it here.
You can feel it.
Yes, yeah. So I'm gonna release this one. Is that too much?
No, it's okay.
Going in? So if it's allow me, I actually try to go as deep as possible,
Okay.
closer to the bone,
Okay.
to really release the deep scar tissue that could be wrapping the individual fibers in the muscle, and deep fascia layer that's trapping individual fiber internally, which is called premiycin, the endomycin. That's why it's hard with massage to really go mechanically. It's hard. It's impossible to go deep with the knuckle or your elbow.
Right, because it doesn't have that
Pointy.
point.
So, and for the scar tissue and fascia restrictions, if we unable to do mechanical force on the scarring, you're too far away from causing release.
Okay.
It's like, when you have your motor in the car, you need to unscrew a screw, but you have a short screwdriver.
Right, can't reach it.
You cannot reach it. That same concept apply here. So you said before you have issue with your shoulder. What's going on?
Yeah, I don't know. I feel like it all just connects.
Okay.
So.
Gonna work on the superficial scar tissue, and I'm using the pain relief cream. There's a lot of people ask like, what kind of cream do you use? This is cream that I worked on for several months to decrease inflammation, to help to be used with the tool so it will glide easily without using too much cream. And it's natural. I personally use it for wound care, and if you have cut or something like that. You feel that here? That's a knot here.
Yeah.
Okay. And we can see the map of your scar tissue where there's redness. And I'm actually...
So where there's redness is where...
The map of your scar tissue. So if there is no scar tissue, and just correlate the feeling of going over the bump to the redness. Because here I'm not going over anything, so I'm doing the release, but there's nothing to release it, so it's not much redness. But here, you feel that? Okay. And here in this knot, and you feel that?
Yep.
Here, it's kind of like going. The scar tissue is kind of in the way of the tool, and it just pushes it the opposite direction.
You're kind of like a bulldozer, or moving it out of the way.
Yep. So what we try to do is kind of shaving it. Sometimes it's depend on the size of the scar tissue. We can really loosen up in one session. If it's a thick scar tissue, sometimes you just need to do a few sessions on it.
Yeah.
Some patient, if you have vitamins, mineral deficiency, we need to address that so the treatment will respond faster, because if you have deficiency in like vitamin K, D, magnesium, so there's a chance that scar tissue is going to be harder. There's other vitamins too involved with it, but okay. We have the option for the home treatment. You get the tools with the self-treatment. It doesn't matter which body part. For the elbow, I have a model. She's doing it on herself. You actually can do it on yourself. Yeah, relax your shoulder, and go up. Yeah, you can hold it in here so it will be easier. Yep. So you can do it on yourself.
Is it good to go all the way or do lower?
Well, we're going to release all the tightness.
Okay.
So when you feel there's a scar tissue, you need to release it. Okay. If you don't feel a scar tissue, you're done on that spot. So for tennis elbow, you definitely can do it on yourself.
Okay.
With the A5, with the A2. If you don't have any issue with the other hand, and you can reach, that's totally can be done at home. Yeah, some patient, if you have a family member, it's more relaxing, but the treatment...
That's why he should watch it.
Yeah, so this is your job. So the treatment is 5 minutes a day, so it's really not
5 minutes.
not require a lot.
Okay.
So even if you do this for 5 minutes. Not this tool, the whole thing.
Oh, okay.
I don't think it's really.
No, that's doable.
You know, you stand the if you want to get Starbucks, you stand in line for more than 5 minutes. So that's not
Yeah.
going to be an issue. So let's actually do the motion that's aggravated. 0 to 10, because you was saying 6, but you were holding this.
Yeah. Oh, I was holding this.
Yep.
That's
Mhm.
funny. But I'm not gonna hit you. Yeah. Maybe like a 3.
Where do you feel it?
Here.
Just that spot.
Yeah.
In the bone or outside?
I think outside.
Right in.
Right in there.
Okay, so let me do one more thing, okay? Right in here.
Mhm.
You feel that
Mhm.
scarring?
Yes.
So I feel grinding here, like I'm actually going over kind of a small rocks or sands. So I'm gonna do this a little bit more as long as it's not painful. Okay? You feel this one here?
Mhm.
And that's where exactly the tendon attached to the bone.
Mhm.
That's very common of issue for tennis elbow.
Yeah, there it is in there.
Try it again. So I haven't used the MagnaHeal yet to see if your pain purely related to the proliferation stage, which is scar tissue, fascia restriction, muscle spasm, and trigger point. How's that?
Yeah, that's better. But maybe still a 2. Maybe a 2.
A 2 in that spot.
Yeah.
So if it's mild inflammation, what I do is I use actually the pain relief cream with the MagnaHeal because they work faster this way. So I'm gonna use now the MagnaHeal Pro. So let's keep this watch away,
Oh, yes.
or you can take it off if you want. Okay. So this is very, very strong magnet. The range of the Pro, relax. When we measured it, it was like 4.5 inches. This is very strong magnet. So if it's mild inflammation, it should be kind of 2 minutes using the magnet. So what I will do, I personally like, if I use it at home or patient in the clinic, but we're not doing it in the video here, have them lie down and just put your arm on the bed and just have it on the top of it because it's kind of heavy.
Yeah.
But we're just doing it here just for the sake of the time. So it's basically you just wait for a few minutes and then we'll test it. If it's mild inflammation, that should be enough.
Okay.
You know. So if you feel it more in that spot, we
Yeah.
need to have it here. Is that
Yeah.
where you feel it?
Yeah, it's more on the side.
Yeah. So we'll have it like this. There you go. So I don't have to hold it.
Yeah.
Yeah. And that's the fun part. Wait. For moderate to severe inflammation, usually we have it like 10-15 minutes on the patient. And if you have moderate to severe inflammation, that typically a sign of vitamins mineral deficiency because the body is not going to transition from inflammation to proliferation to maturation stage, which basically healed, unless you have magnesium B, C, D, K. So there's a lot of other ingredients that affecting the normal body healing cycle and actually that sequence to go down. So the magnet can help with the inflammation, but if you have magnesium deficiency, B deficiency, D deficiency, that's not an ingredient in the magnet. We have to meet that. That's especially with the arthritic patient or have rheumatoid arthritis or other health issues. Those actually kind of sign of vitamins mineral deficiency, so the body is not getting enough of those nutrients, so the body will transition very slow or actually stuck in a inflammation and proliferation vicious cycle.
Yeah.
Okay, so we'll try it again. Here you go.
Okay.
It's a bit more.
Oh my goodness, though, it's.
Yeah.
Oh yeah.
Gone.
Oh, I get to play again.
You see, and you get a.
Oh, I'm very excited.
That's cool.
3 years.
4 years, you said?
3.
3 years. That's awesome. Yeah.
That's amazing.
Yeah. Make sure if you do that at home, no one around you. Okay. or if you hit them, don't blame it on me. That's your responsibility. So one time I actually taught a patient to do, like, she had knee issues, so I told her, anytime you said we need to strengthen your knee muscle, just do knee extension.
That's amazing.
So she was sitting in the doctor's office and she was doing this and she kicked someone, fell down. And she told him, my doctor told me to do that. I'm like, no, I did not tell you to hit people and kick them. I told them, do the exercise safely.
Oh my goodness.
So any pain, discomfort with that?
No, it feels great.
Okay. So you had the tennis elbow for 3 years. Now we just worked on it with ASTR treatment for a few minutes. So what do you think about the treatment?
I think it's amazing.
Mhm.
I think it's amazing, and I just felt like I was just going to live with that the rest of my life
Mhm.
because that's the way it was going to be.
Yeah, okay.
That's amazing.
Awesome. Thank you.
Thank you.
Thank you.
Wow.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to astarinstitute.com.